Good afternoon. Thank you so much for coming today. I started at 6 o'clock this morning in another city speaking. We're going to wind up at the end in my hometown here in New Orleans. So it's always a pleasure to be with you. I'm Dr. Kelly Birkenstock. I'm a native of New Orleans, actually. And after the storm, I've moved on over to Mandeville, and we have a big center there. In that center, we do a full scheme of diabetic, skin health, as well as skin care, rejuvenation, Botox fillers, and all that fun stuff as well. But we also do down-home good skincare cleaning, skincare repair, and nutrition counseling for diabetes patients. In the upstairs of our clinic in the Mandeville office, we also have a full-service spa. And you know, while there's some ladies and gentlemen that enjoy relaxing up there, which is always a good thing because when we decrease stress, we decrease sugar, right? But in addition to that, we offer pedicure services, diabetic pedicure services, which are so very important because, as we know, the skin of the feet and the hands are kept clean and fungal-free, virus-free. We have a better chance of not getting those ulcerated diabetic wounds and diabetic funguses that can be such a nuisance, not only to us, but wreak havoc and cause our blood sugar counts to go up. Let's see a show of hands. Who in the audience has diabetes? Oh, wow, okay. And okay, how about who doesn't have diabetes? Are you here listening for someone else or just interested in the topic?
Someone else.
Someone else that you know and love, huh? So without further ado, we all know that when we have diabetes, we have to take very special care of our skin. We're going to go through the disease states that can change in diabetes. What I mean by changes, those that can get worse, and of course they can all get worse, and those that can get better. And the ones that, well, no matter what we do, they're still going to be around. But they're a nuisance. What can we do for that? About a third of the people with diabetes will form some kind of a skin disorder during the entire disease state that they have. That's going to be a lifelong disease state. Some skin issues that we see can be an actual warning sign of diabetes. So, for example, as we'll get into later, when we see these leathery patches under the arms or in the groin and some other areas, we actually know that those are warning signs for diabetes, and we should be looking and testing with blood sugar, glucose monitors, or the doctor should be looking in different ways to look for insulin resistance, polycystic ovarian syndrome, and the like. The good news is that many of the skin conditions that come along with diabetes, if they're treated properly and if our sugar is controlled, can improve. Type 1 and 2 diabetes, so both the insulin-dependent that the young, thinner people typically get, as well as the older type 2 diabetes that typically comes on with age and a little bit more weight, bad eating habits, obesity. Both of those do have skin disorders associated with them. And what happens is there's an increase in the cross-linking of collagen in diabetes that actually adds to this problem of skin issues occurring topically where we can see them. Inflammation and poor gut function, which we'll get into a lot of that later, also leads to skin disorders. Skin disorders can help the doctor not only in the diagnosis of insulin resistance and diabetes, but also in their management and treatment. Because as you'll come to see, the skin disorders that are treatable get better when what? When our sugar is down, right? Hemoglobin A1C. Is everybody familiar with that term, hemoglobin A1C? HbA1c? Yeah. That, of course, is the average, the 3 months average of our blood sugar in the body. And so we know, not only just a pinprick, that tells me what's happening when, right now. Or we have a fasting glucose, where we fast overnight and we go get blood for the doctor, and it tells us what our blood is that morning. But that's just that moment in time. The hemoglobin A1C gives us an average of what our blood glucose or blood sugar has been over the 3 months. And when we have that, then we know how the molecules have been affected over that 3-month time span and whether or not, on average, we've been spiking high or spiking low. And sometimes we get a surprise, don't we? Because we say, well, every time I check my sugar, it's been really good. Well, how do we explain that? Well, either postprandial, which post means after, prandial means eating. So either right after eating, you're really surging up to the moon, or in other instances, you're making sugar when you sleep. And then when you wake up, it's high. Well, why could that be? From cortisol production. What's cortisol? One of those hormones that's inside of us, that when the body's under stress, either stress like, oh my God, he wrecked the car again. Or it could be stress that I'm sick. My body's under stress and it's trying to get over something. or I'm in pain, broke my leg, and I'm under distress and the pain of that leg, that's going to send up cortisol surges, and that's going to uptake the sugar. And you can say, my goodness, all I had yesterday was lettuce. How could this be? Well, that's how it can be. In skin and diabetes, there are 3 persistent conditions that we can do soothing measures for, but we really can't make them better by improving our lifestyle. That doesn't mean we don't want to improve our lifestyle. However, but we must face certain things when they're there. And the 3 are atherosclerosis, peripheral arterial disease, necrobiosis lipoitica, and vitiligo. So we'll talk briefly on those 3. So with atherosclerosis, peripheral arterial disease, that's when the blood vessels are narrowing from the plaque that's forming inside the canal of the vessels, the blood vessels or the arteries. Those narrow, thick arteries begin to change due to that lack of oxygen, because the oxygen is less because they're narrowed. And what happens is on the surface, you see the shiny, shiny skin. It gets thin and shiny. On the toenails, you can see thick, discolored toenails. And it's also, again, due from the lack of oxygen permeating through the skin from the tiny arteries that feed the skin. The other thing you can sometimes see is cold skin. The rest of your body may be warm, but in those extremities, they can be really, really cold with that shiny, thin skin. Also, because the blood and the oxygen carry the white blood cells, which are our fighter elements for the body, when we have this peripheral arterial disease and we get injured, we don't heal as well, because the white blood cells can't get down to the wound to help that wound heal. So that's why it takes us so much longer to heal, or at least one of the reasons, when we have diabetes. Necrobiosis lipoitica. Basically, that big old word means that we're losing fat and collagen in some of the areas of the body, some of the skinned areas of the body, and that overlying skin appears very thin and red with a yellow center. Ulcers can actually form here. It's not always associated with diabetes, but mostly is, and it's a long-term or permanent decrease in collagen and fat in those areas. The third disease state, which is often seen not only with diabetes but other autoimmune disorders, is vitiligo. Vitiligo is where we have a disorder in the melanin pigment from some of these issues going on. And they're not totally understood. It's not just a loss of oxygen, it's just not just a high blood sugar, but a multitude of issues. And in those cases, the pigment, because the melanin cells get destroyed, actually leaves the body. So you'll get patches of white. And it can be on the trunk, on the face, and even down by the hands and feet. With vitiligo, there are some things to sort of improve it short term, but there's nothing that will absolutely cure it. They use ultraviolet light, steroid creams, vitamins. Actually, vitamin B12 and folate injections are very, very helpful in sort of ameliorating this. Not curing it, but helping it. B12 and folate, if you know anything about them, are very, very wonderful vitamins that I use all the time in practice to help various sorts of ailments, injuries, not only skin disorders. For those of you who don't know much about me, I'm board certified in internal medicine. I also have a very keen interest in alternative medicine. And I've studied with the A4M group with this alternative medicine, integrative medicine, regenerative medicine. Anyway, and we use vitamins in very large part to cure some diseases that otherwise weren't thought curable. Sunscreen is also very, very important when you have vitiligo, because the places where you've lost the pigment are actually unprotected skin. It's skin that absolutely can't protect itself because there are no more melanin cells that are actually there still working. So they must be protected with sunscreen. A proper sunscreen is sunscreen with titanium or zinc. I'll show you those words on the next screen. What you'll find in the drugstore is a multitude of different varieties of sunscreens. Neutrogena might have 11 sitting on the shelf, right? And most of them start off with octreonide, octreosam, octa something, OCT something. Those aren't proper sunscreens. Those are screened from the sun, but they won't block the sun. So therefore, they're not blocking the harmful rays. Your only two sunblocks or sunscreens, but proper sunscreens, are those made with titanium dioxide or zinc oxide, titanium and zinc. So those are the two buzzwords you're going to want to look for. We're going to move on now to the skin and diabetes treatable issues. issues that are there, but certainly can be treatable, and in many cases can be cured. If not cured, ameliorated, meaning lessened to a great deal. First one is scleroderma diabeticorum. Is a skin thickening of the upper back and neck. Some people call this a peau d'orange look if you were up close. It almost looks like the skin of an orange, peau d'orange. It's sort of a dimply appearance. And where this is affected, the skin is very, very thick, and people can lose sensation to pain and touch. So they would actually not know it if they've maybe hit something, a doorknob there, or if they came too close to something very hot or warm, maybe an old-time furnace heater or something. And that's where some injuries can and do occur. What's neat about this, unlike the first three that we talked about, is by controlling blood sugar and probiotics, which is a certain type of nutritional supplement I'll get into in a little while, this disorder can actually be improved a great deal. Moisturizers, of course, can help. And when you looking for a moisturizer, nothing with an alcohol base in it, something with like a vitamin E and squalane, which are natural from the fruit of the earth, and give you much greater coverage without that alcohol. Alcohol will give you, in the beginning, a good feeling, but then as time goes on, it dries out the skin more. Most of your over-the-counter lotions and moisturizers have an alcohol base of some sort to them. So you wind up long-term not doing anything good at all. Acanthosis nigricans. Acanthosis nigricans is one of my favorite skin disorders because it is a tattletale of what's to come. So if I look at an overweight, obese teenager and I say, please raise your arms for me, and I see this thickened, velvety brown skin, or if I say, bend your neck for me, and I see it in the folds here, or if I'm examining their breast tissue for something, whether it's a male or female, and I see this velvety brown underneath the breast tissue, I know I better go check that patient for insulin resistance. Insulin resistance means my body is resistant to insulin, therefore my sugar is high, because what keeps sugar low in the body? Insulin. So if my blood is resistant to the insulin, if it's not getting in and doing its job, then my sugar's on its way to getting real, real high, right? So it's seen not only with insulin resistance and diabetes, but also obesity, thyroid disorders, polycystic ovarian syndrome in young ladies, and endocrine cancers. And the endocrine cancer, we always want to have a light bulb as a physician to make sure I look for anything that could be related to that. Weight loss, exercise, nutrition, and of course, good moisturizers like squalene and vitamin E is something that can help. The next disorder we're going to talk about is digital sclerosis. Digital meaning fingers, sclerosis meaning hardening. Okay? So this is a disorder when the skin on the toes to fingers, hands becomes waxy and tight. Stiffness of the finger joints can sometimes accompany this. This situation is improved when we decrease our blood sugar, take probiotics, and exercise. While we might not be able to get the joints back to completely normal, we can get a substantial improvement in the digital sclerosis by keeping the blood sugar under control. Next disorder I'm going to talk about is eruptive xanthomas. Eruptive xanthomas are another very, very important tattletale or telltale sign to the physician to, hey, if I don't know that this person's got diabetes or high cholesterol, I better go look. So if I get a new patient that comes in and they've got eruptive xanthomas or waxy yellow bumpy things on their face or their back or their trunk, I immediately start thinking, I wonder what the cholesterol is of this particular patient. I wonder what the sugar state is of this particular new patient. This occurs in very, very high triglycerides, which is your sugary cholesterol or your fat cholesterol. And what happens with eruptive xanthomas is literally the fatty cholesterol is coming through the skin. Triglycerides are elevated, that's a type of cholesterol, and it's elevated when your blood sugar is high. And when you get very, very high elevations in the triglycerides, what happens is you see sometimes this eruptive xanthoma. It's a resistance to insulin, and so when we have this resistance to insulin, the body has a very hard time of clearing fat from the blood. So this fatty cholesterol starts oozing out, and it has nowhere else to go, so where it's going to go? Into the liver, into the skin, into the body, laying down plaque. If it gets high enough, the patient will get pancreatitis. So another good reason why the physician wants to catch it, bring the triglycerides down, and therefore not only prevent the person from getting a possible pancreatitis, but also when you bring these triglyceride cholesterol down and you bring blood sugar down, these eruptive xanthomas resolve. They go away. So if we come back in 2 years and I see them again, guess what? Somebody's not been following my orders, huh? Diabetic dermopathy is a condition we see, that's the most common condition we see in diabetes, is diabetic dermopathy. This is sort of just a dark brown or light brown spots seen on both legs. They don't have to be the same size, shape, and color. Usually, most of the time, they're not. And when we see these on the lower legs or shins, we know that the patient has diabetes and probably has had it for a long time. Sometimes these will get better and resolve on their own. A lot of times they will shrink substantially or lighten as we improve the blood glucose. So it's important to keep the blood glucose down so that we can get some of these to resolve. They're usually found on the shins, and sometimes the nickname is shin spots, but the formal name is diabetic dermopathy. The last skin disorder that I'm going to focus on today is acne and rosacea. As we know, teenagers aren't the only ones that get acne, especially in this day and age. Lots of older ladies and older men get rosacea, which is an adult form of acne, as well as straightforward acne. Acne is aggravated by stress. Not only stress, hormonal changes. Not only hormonal changes, gut changes. I keep coming back to that gut, don't I? I'm going to tell you more about that in a minute. When the gut changes and the inflammation factors go up, it causes a cascade of events and a release of a substance called protein P and other things that start a whole inflammation cascade. When that cascade occurs, we break out on the face. And it can be in the form of pustules, cysts, blackheads, red bumps, but nonetheless it's acne, and it's aggravating. It's unsightly, and we don't like to have it. With the rosacea form, we also get a red complexion in the background, and we can get some broken capillaries. So we know that genetics can predispose us to this, as well as stress, hormones. But where the gut becomes important is high sugary foods, processed comfort foods, or one of the main things that will cause this cascade to take off. We have so many fast food establishments, and we're all so much more busy than we were in the last generation or the one before that. It's not unlikely that we're seeing a lot more acne and rosacea in adulthood. There's a lot more processed foods, there's a lot more high refined sugars, and if that wasn't enough, all of our fast food chains are putting hormones in the food. So there's your triple whammy. The treatment for this would be high fiber type diets, low sugar diets, probiotics, and then the various applications topically. Flagyl, metronidazole, just name of some medicated gels, retin-A, antibiotics, and of course vitamins, so important for the skin. Vitamin E, vitamin C, vitamin K. I'm going to move on now to the gut-brain-skin axis. This is one of the new theories in medicine, and what we know about the gut-brain-skin axis is when the gut's not healthy, the skin nor the brain is happy. Lots of other organs are affected too. These are the three biggies: gut, skin, brain. So when we infuse the gut with processed, high sugary foods, comfort foods, Stouffer's, meatballs and spaghetti, okay? Bread, rice, pasta, potatoes, cheesecake, all the goods, the French fries. That in combination with stress, again, whether it's physical stress, whether it's pain stress, whether it's emotional stress, those in combination slow down the gut motility, meaning slow down the way the foods go through the stomach, the gut. And when the foods go slower and slower through the gut, It changes the type of bacteria that lives in that stomach or gut. And it goes from a good bacteria, which absorbs beautiful vitamins and minerals that keep us young and healthy and not age, into a situation where in the gut we're absorbing bad bacteria. And the gut becomes leaky, like a garden hose that sprouts leaks. And toxins go into the body. And inflammation starts. And the body gets all upset. And when that happens, it goes to the skin. And we start seeing all the things we talk about. Acanthosis nigricans, dermopathy. All these horrible lesions and thickening, things that we don't want to see. And then, of course, things that we don't want to feel, because that means we've got diabetes and other things lurking in the wind. In the brain, I think it's very, very interesting that not only when the gut gets sick do we have skin manifestations of one of our diseases, like diabetes or one of our other autoimmune diseases, but our brain also gets sick. When the gut is leaking, when it's lacking probiotics and it's not healthy, you decrease the amount of serotonin, dopamine, and norepinephrine and epinephrine that you make. Well, what are those? Those are the things that keep us not depressed and not anxious. Wait a minute. Are you telling me the way I'm eating is making me depressed? That's what I'm telling you. That's what I'm telling you. Are you telling me that by correcting my diet and taking probiotics and eating right and getting that situation corrected, I could lose depression? I could make my depression go away? I could cure my depression? Yeah, you can. In addition to that, of the 6 treatable diabetic skin conditions, most of those will get a whole lot better when we get the gut back on track. This is very new on the horizon. This was just presented in January at the Academy of Dermatology that I attended in Orlando, January 2014. This theory's been lingering out there for a while, but they're finally now getting the studies back in that are beginning to show beyond a shadow of a doubt the gut-brain-skin axis is in fact a viable axis, and when we feed it the proper nutritional substances and probiotics and get the gut healthy again, that we can reverse a lot of this process. So the gut controls 70% of the immune system. Probiotics in the gut or stomach tissue interact to handle allergens, bacteria, cancer attacks, etc. So when the gut sees an allergen and it's about to give you a bad allergy attack, it could handle that attack if it was in a healthy state. And you might not get that allergy breakthrough. Same thing with bacteria. You might not get that sinusitis or that wound that got infected, etc. Cancer attacks. Every day, I don't know that you know this, most of us at some point in our lives, many times a week, sometimes even daily, are presented with a cancer particle in our body. And most of the time, the gut takes it and it has these special little cells that eat it and throw it away, put it into the bowel, and out it goes. We never even know it said hello to us, and we're just glad it said goodbye. Okay? But when the gut immune system barrier is broken, then it can't do its job. And then sometimes we see the word we don't want to see, the cancer word. So it's important. Probiotics regulate inflammation within the skin and improve insulin sensitivity. So you're also helping your sugar control with something very, very natural. Doesn't mean you can throw your diabetic medication away, of course. But if you can improve the way your gut is absorbing vitamins and minerals, then you can improve your body's sensitivity, your blood vessel sensitivity to insulin, and have everything work better. Normal blood sugar. Normal blood sugar is between 80 and 100 fasting, that's after an overnight fast. Impaired glucose 101 and 125, and diabetes is anything over 126 when you wake up. How many people think it's a-okay that I don't have to worry until I hit 126? How many people think that? Okay. The brave ones in the group. There's probably a few more, but I think that was a trick question, right? Anytime you're over 100 when you wake up, you're in trouble. The body doesn't care if you're impaired glucose. Oh, I could give you some fancy words. Postprandial hyperglycemia. Doesn't that sound really swift? Oh, I'm not in trouble yet. That's not diabetes. Impaired glucose tolerance. Oh, good. I don't have diabetes yet. Any of those words all mean the same thing. The minute your sugar's over 100, you're in trouble, darling. And if you don't take care of that in the beginning stages, you're going to take care of it in the end stages. And having a little bit of high blood sugar is just as bad as having too much. Once the sugar is over the point of normal, it's going around the body like Pac-Man, eating our nerves and arteries and blood vessels by our retina, by our kidneys, the nerves and arteries in the hands and feet, the heart. So it's doing damage all over. It's not just about big, huge, oh God, now I'm a diabetic. Be worried in the beginning stages and take what you need to do. Take action. Exercise, diet, get on a low sugar diet, low processed food, high fiber. That's what's going to make a difference for you. So, knowing blood sugar, what can we do? We can monitor our blood sugar to make sure we're on track. We can do healthy eating, regular exercise, meditation to decrease that stress, because we know stress is turning on that cortisol, which is turning on that sugar pump. That's not even fair because we didn't eat it, right? And diabetes, supplements, medication, and or insulin, depending on what state we're at, and we've discussed that with our provider. One of the main things that we need for a diabetic is a good Mediterranean diet. And with a Mediterranean diet, you're having lots of fresh fruits and vegetables, lean meats, lots of fish, baked broiled fish, salads, olives, feta cheese when you're going to have a feta cheese, or another light cheese and small amounts of it. When you're going to have a choice for a buttery substance, you're going to want it to be a virgin olive oil or maybe a little canola oil, and not butter and not one of the fake margarines. Mediterranean diet has been shown to have a reduced risk of overall disease states across the board, not just in diabetes. It reduces cancer, Parkinson's disorders, Alzheimer's, and of course it helps in AIDS and diabetes. So the Mediterranean diet isn't just about the food on the table. The Mediterranean diet also tells us that we need Mediterranean lifestyle, perhaps is a better word. We need plenty of exercise, eating primarily plant-based foods, fruits, vegetables, grains, whole nuts, using herbs and spices instead of salt, limiting red meat to no more than a few times a month, eating a lot of fish and poultry, turkey, chickens, drinking red wine or red grapes in moderation. Of course, if you have an issue with alcohol, absolutely not. But there's resveratrol found in the red grapes and red wine, and small amounts can be very beneficial to decrease the inflammatory state in the body. They have also found in studies that enjoying food with friends and family reduces stress. So how about that? You want to work out every day. It doesn't have to be the Arnold Schwarzenegger workout. But even walking around the block, doing some sort of activity for 30 minutes a day on most days is wonderful. Whether it's whatever you can do, stationary bike, walking, bike riding. Reducing stress. Stress reduction is accomplished via body detoxification, spa therapies, meditation, and exercise. All of them are important. Most of us these days have computers. If not, you can get on cassette meditations, 5-minute meditations. If you do those once in the morning, once in the evening, or just once a day, you can dramatically decrease your stress. There's so much to be said for the power of touch. For those of you who can go out and get a pedicure, a manicure, a massage, the gift of touch is extremely therapeutic and will help your body in more ways than one. So in conclusion, nearly all patients with diabetes eventually develop some type of skin disorder. Controlling diabetes is the most important factor in preventing these skin disorders from not only taking charge, but in developing and becoming chronic and becoming worse. Follow your doctor's advice regarding nutrition, exercise, and medication. Keep your blood glucose in a level at the range the doctor recommended. Usually in the morning, we'd love to have it between 70 and 100, unless you've been directed otherwise for another reason. Proper skin care can also reduce your risk of some of the more severe problems that can happen with the skin. So some of these conditions left untreated, I think it goes without saying, can become ulcerated, gangrene, infected. If it's in the feet, they can go down to a deep infection, infect the bone, where then you get an infection of the bone, otherwise known as osteomyelitis, which can put the whole foot in danger, and then go on to amputations. And some of the things that we've seen years and years ago, and thank God we don't see so much of that today, but we do still see it. Are there any questions? Yes.
I got a question for you. I'm a big red meat eater. I eat chicken. But what is the deal with chicken? Because chicken, from what I understand, is so filled with chemicals and steroids and this, that, and the other. I'd rather have some dead cow myself.
You know, it's a very good question. And the question is with all the talk today about chickens being full of steroid chemicals, is the chicken really much safer than the cow or the steak? And the answer to that is it's a complicated one. You know, for the people who can afford the organic chickens or the homegrown chickens or the chickens that are raised without steroids and chemicals, then of course by far chicken is the better meat. It's got much less fat and it's got some very, very important nutrients inside the chicken. Baked, broiled, of course, not fried. When you look to the beef, there's a lot more fat, but there are some good components and good nutrients to beef as well. It's especially important to know that if I'm going to choose beef, I'm going to cook it into a fashion that's going to be most beneficial to me. So I'm going to trim off all the fat. I'm going to buy lean cuts of meat, and then I'm going to bake, broil, or grill. Thank you. Bake, broil, or grill, and I'm not going to put it down deep in gravies and sauces, which just add to the calorie burden, or fry it before I bake it, and those sorts of things. So it's a very, very good question, and you're right. In today's world, they had made a little complex for us because we have to be very careful of the meat we buy and who's put steroids in the meat, which will aggravate the whole inflammation cycle. Not necessarily it won't pump up your sugar, even though it's a steroid, but in the background, it will trigger the inflammation cascade. So that's a very good question. Yes?
Because I have irritable bowel syndrome,
Yes.
diabetes, and fast condition. How does all that affect each other when I'm trying to help? Like when I test my blood sugar, sometimes it'll be 233. Then when I do it again, 256 within seconds. That's what I don't understand.
Well,
that fast.
Okay, that's a couple questions in one, and I'll address them all. First, the Accu-Check or her sugar checking monitor is jumping from 233 to 256 within a few seconds, and how can that be happening? It's because it's the best technology we can come up right now, and it's not perfect. We would have to draw blood out of your arm to get it exactly perfect. But what we know is 230, it's high, right? We know it's high. Oh, shoot. The other question you asked me was, you have irritable bowels, diabetes, and
I'm past, so I was a blue baby, but I don't take any medication for that at all.
Wonderful.
Thank you. And it was 50 years since my heart operation, and I'm still going strong. But the diabetes and the IBS, can that interact and make my IBS worse too?
It actually is, but I'm more about the IBS making the diabetes worse.
Oh, okay.
So with irritable bowel comes with, after we eat, either substantial constipation or substantial diarrhea, or both, or alternating. Sometimes diarrhea, sometimes constipation, okay? And what is that telling us? That goes right back to the gut, brain, skin axis. What has happened over time is that your gut, maybe through medications, maybe through just motility issues, meaning movement issues of how your body's moving the food through, your gut got lazy and it started moving too slow. Bad bacteria came in, which makes irritable bowel syndrome dramatically worse or can initiate it altogether. And one of the things that we know that can put it to remission, sometimes for lucky people, probiotics. Okay. Yes.
If the skin is thin on the tops of the hands, does it mean I should cream more?
I would put a good cream, because remember, most of the things that you get at Walgreens, Walmart, or any of the department stores have a lot of alcohol base to them. So you're putting on something that initially feels good, and then later makes you more dry than you ever were in the first place. Okay. So vitamin E and a squalene, which is natural from the fruit of the earth, is a wonderful moisturizer that has no chemicals or preservatives in it. And while I'm thinking about it, probiotics, you want very, very high grade. You want minimum of 15 billion, it'll say on the label, 15 billion units of live bacteria in it.
Cultures.
Okay? Thank you. Live cultures in it. Thank you. Because if not, you're buying somebody's marketing ploy. Okay? And because they're live, you want the ones that are refrigerated, because if the label says it had 20 billion when manufactured, well, when was that? I don't really care what it had in it when it was manufactured. I want to know what it has in it today. And if I put it on the shelf and it's been sitting there for 2 years, I don't think it still has that in it, right? Anything that's live, anything that's fresh, anything that's supposed to stay fresh, what do we do with it? We refrigerate it, okay? So if you're buying it already in a dry package, chances are it's not as potent as it was. All those wonderful live cultures, which you were needing in the first place, aren't there. The other thing I want to make comment to is, of course, we want the fresh fruits, the fresh vegetables, the lean meats, as we were speaking of. But in addition to that, you want your Greek yogurt. Greek non-flavored yogurt, because that's what's got some natural live probiotic cultures in it. And you can take your live refrigerated probiotic powder, add it right to that, and then you've got yourself a nice double dose of it, which is wonderful. Can't get enough.
What do you take with the yogurt?
Probiotic, the powder, the live probiotic powder, that's refrigerated, so that you know your cultures are still there.
With the green yogurt?
With the Greek yogurt.
That doesn't agree with me. Greek yogurt.
You know why it doesn't agree with you? Because your gut is so unhealthy right now, it's irritating it. So do it in small doses every few days. Small doses every few days, and you'll build up to be able to have it in it. Some of the things that you can find in the stores are okay. A lot of it is a marketing ploy, so you have to be careful because the FDA does not regulate vitamins in stores or supplements in stores. So we have to be real careful of that. If it's got the GMP seal of approval, G like a goat, M like a mouse, P like Paul, GMP, that means it's a vitamin or supplement that was made in an FDA-approved facility. So you know you're getting something of value.
Is it baby good for colon, like you say, or is that just a
You know, unfortunately, the little yogurts that you find in the grocery store have so little, they do have live cultures, but so little of them, you'd have to eat exorbitant amounts to really get a decent dose. The Greek yogurts are better, but you still want to even supplement that. But so if I'm going to have a choice between a small frozen yogurt or a Greek yogurt, I'm going to have Greek yogurt, right? To try to get some nutritional value out of it.
I only tried a Greek yogurt once. It had a 4-letter name.
Uh-huh.
I thought it was horrible. What can you do to make that will be helpful, but can make it more?
Yeah, some people put 1 teaspoon of jelly in it, low sugar jelly or sugar-free jelly, to change the taste a little bit. Yeah. Some people also use Crystal Light. Put a little Crystal Light in it. Yeah, to change the flavor.
Can I ask you to
Yes.
repeat something, please?
Sure.
You said Greek yogurt with probiotics, but it's in a powder.
It does come several different ways, but what I'm speaking of, and there's many different brands, but live probiotic powder. So it's got the live cultures in it, and you just sprinkle it. Yeah. And it really doesn't have a taste to it, so it's not bitter, it's not salty, it's not sweet. I'm not sure if they have it. A lot of physicians' offices will have it, and I know they have it online as well. I'm not sure whether or not the grocery stores have it.
Dr. Burkenstock, regimental therapy for probiotic use would be what in an overdose? What would you suggest for our
You know, your body, it's really hard to overdose on a good, natural, live probiotic. But your body will tell you. If you're getting too much flatulence or gas consecutively after you've broken and gotten yourself used to it, you may be doing a little too much. If you're getting extensive bloating after you've got used to it, not in the beginning, you may be getting a little too much. And just back off a little bit. But I get that report very rare. It's, in our day and age, the way we eat, it's really hard to get that gut too healthy. It just really is. But, and then with the live probiotics, you do want to start maybe every 3 days and make sure it agrees with you. Because sometimes it does take a little bit to get used to it.
I've been taking probiotics in capsules.
Uh-huh.
Is that not as good?
It's not valueless. It's just not quite as good. Okay? Well, thank you very much. It's been an absolute pleasure speaking to you all this afternoon. Always nice to come back to my hometown.
You just gotta ignite the light.